Dr. Carmen Corder here with ACLS Certification Association, and today's lesson is on insulin. Don't forget to visit us online at aclscertification.org to certify or recertify your ACLS, PALS, BLS, or NRP 100% online. Now let's get started. We're going to talk about several different types of insulin, the most common types of insulin that you're going to see in practice in the hospital setting and be tested over in this video. So let's just talk about these three terms up here at the top. So we've got the onset, which that is when the insulin kicks in. Okay, that's when it starts working. The peak is when the insulin is working the hardest. It's kicking in and fighting hyperglycemia at its peak level with the strongest punch. And the duration is basically another word for when the insulin is out of the patient's system. So we're going to start with the rapid acting insulins. And I've got listed under rapid acting, the most common ones that you'll see are the Lispro and the Aspart. Now, you'll see the Aspart, this is the Novolog. It ends in LOG, that we give most commonly for sliding scale insulin. So when you're checking your patient's blood sugar, usually it's ordered ACLS or every 6 hours. And when you're in clinical, you're going to check your patient's blood sugar before lunch, right? For that every 6 hours or ACLS schedule. And if their sugar is high, they're going to require sliding scale insulin. Well, most of the hospitals now have moved to using one of the rapid acting types of insulin to cover sliding scale needs. So most of the time you'll be giving Novolog. And that is one of the reasons you'll see that the onset here is within 30 minutes for all of the rapid acting. So no later than 30 minutes, these insulins start working and kicking in. So that is why we can't go in and say check our patient's blood sugar at 10:30 and give them their insulin when their lunch trays are not going to be around until say 12:30, okay? Because the insulin by then it's going to be peaking out. So it's going to be working at its most powerful rate within 2 hours. So the onset of your rapid acting, your Lispro, Novolog, the onset is within 30 minutes. So within 30 minutes, that insulin is working. It is peaking within about 2 hours. So if you give this rapid acting insulin, that's why it's called rapid acting. It is peaking out within 2 hours. So it's packing its full punch in 2 hours. And then within about 4 hours, it's out of the patient's system. So the rapid acting is in and out within 4 to 5 hours. And these are kind of generalizations because when you start trying to remember, 15 to 30 minutes, 30 minutes to an hour, it gets a little hard to remember. But just remember that your rapid acting are your Lispro, your Novolog, Aspart, and the peak really is the most probably important factor that you need to remember. That's what you're going to be tested over. They're going to ask you things like, when would you want to, make sure that the patient has their food after administering this type of insulin? And you obviously want to make sure that they have their food before the insulin is at its peak. Next, we have the short acting. And we used to use the short acting or the regular most often, but it seems like most of the hospitals that I'm working in now have switched over to the rapid acting. Now the onset for the short acting is within an hour. Some of them are going to start working within 30 minutes, but all of them will be working within 1 hour of giving that insulin injection. It takes a little bit longer for the short acting to peak. So within 3 hours, these insulins peak out. And then within about 8 hours, these insulins are out of the patient's system. So your rapid and your short acting, they do their job and they're out of the system within 8 hours, all right? And that is your Novolin R or your regular insulin. Moving on down to your intermediate acting, you can see with the duration between the short acting versus the intermediate, there is a huge difference. So when you go from short acting to intermediate acting, there's a huge difference in the duration of these insulins. So NPH is your intermediate acting insulin. So I think of intermediate NPH, and it has an onset between 1 to 2 hours. So it's definitely going to be in the system and working within 2 hours at the most. It peaks out in 10 hours. You'll see different ranges. Some will say 8 to 14 hours, but I'm giving you an approximation. So within about 10 hours of receiving that insulin at NPH, it is peaking out at its peak working power, if you will. And then the duration, within about 18 hours, it's out of the system. So this insulin hangs around for quite some time, 18 hours. Then finally, our long-acting Levemir. I remember long-acting Levemir, but anytime you see an insulin that ends in IR or mir, it is a long-acting insulin. And this is the type of insulin that you night shift nurses will give at night to protect the patient overnight from hyperglycemia. And it again has an onset. See, all your onsets of your insulins are pretty close. They all start working within about the same amount of time. The big differences are the peak and duration. So within 1 to 2 hours, the Levemir or the Detamir is working. It doesn't peak for 18 hours. And then within about 24 hours, it is out of the patient's system. So long acting is your Levemir. Its onset, again, it's not too different than the rest of your insulins. The peak is in 18 hours, and within 24, it is out of the patient's system. That's it for our lesson today. Thanks for watching, and remember to check out our website at aclscertification.org for more free content or to get certified or recertified online.